one of the first questions I got was from a young person in Minnesota who said, you know, when you're getting feedback that says it's not working, and you're in an organization where the only way to keep your job is if it's quote-unquote working, what's the incentive to sort of not make excuses and say, well, it's not working everywhere, but it's working over here, and sort of trumpet your successes and brush your failures under the carpet? How do we get that feedback loop to work when there's self-interest in the way?
I think fundamentally, you need to make information publicly available. You need to be honest with yourself, but you need to make it available to the public. Take the issue of blood pressure control. Very interesting. When you do doctor grading, it doesn't do what we thought it would do. We thought patients would go online and figure out who are the better doctors. But as doctors, we hate to be anywhere other than at the top of the class. So it does change our behavior a lot. So making information public is critically important.
So bringing something else into the feedback loop is good too. Another question we got from one of the delegates here was, you know, the name CDC, the Center for Disease Control and Prevention, as you point out, it just conjures up sort of epidemics and quarantines and biolabs. It doesn't sound like the U.S. Public Health Service. Is it time for a new name?
CDC has a great brand. In fact, our brand is so good that all over the world, governments are starting their own CDCs. China has started its own CDC, and it's called China CDC, in huge letters, 10 times bigger than that, even though CDC doesn't mean anything in Chinese.
Fantastic. So you talked about the prevention, and you talked about chronic diseases or chronic issues. High blood pressure is not a disease, typically. So you're starting to deal with many of the great challenges, if you will, that are social. How much of your organization's budget is devoted to essentially the non-scientific side of things, like advertising you mentioned?
We focus, first off, on doing what works. And most of our budget goes out to state and local entities to help them do what works on the front lines, because that's where it'll make a big difference. We tend to try to get free media, for example, by being clever in how we
like
publicize
this
things.
would be the clever part, yeah? Okay. So you mentioned, you know, we often think of India as a country with essentially two classes, an emerging middle class and some very few wealthy, and then an extraordinarily large class of the poor. And yet you spent years and years there, many years, I think 5 years you spent there. That tells me we have a lot to learn from a country like India. And people think America, you know, a modern industrialized state, what do we have to learn from a country like India? It sounds like you spent a fair amount of time learning.
Absolutely. And, you know, it's a tremendous privilege to work in another country, in another community. One of the things I learned was the concept that a country could say, you know, over the next 5 years, we're going to try to accomplish this. And when I became health commissioner in New York City, we created a plan to say, we're going to hold ourselves accountable in the next 4 years for the following things: reducing smoking, increasing blood pressure control. And similarly, I think with that kind of focus, publicly stated, collectively agreed to, you can get tremendous progress.
Tom, thank you very much for joining us.
Thank you.
It was a pleasure to have you.